So today let us discuss why fasciocutaneous flaps are preferred over muscle flaps for bedsore reconstruction. Now, as we all know, fasciocutaneous flaps have got fascia and thick dermis. So these flaps are thicker and more resilient to avoid recurrences, especially in cases of bedsore. Now there is a thing which is functional loss, which also needs to be considered. If the patient is ambulatory and has bedsore, muscle flaps are a big no. But even in those patients who are non-ambulatory, muscle flaps should be left as a last option, because the complication rates of muscle flaps, for example hematoma formation, are more than that of fasciocutaneous flaps. Fasciocutaneous flaps can be re-advanced, because as we know, in bedsores recurrence is almost always the rule and repeated surgeries are required. So re-advancement is possible in fasciocutaneous flaps, whereas in muscle flaps re-advancement is not possible. The ischemia time of muscles is very less as compared to fasciocutaneous flaps. Therefore, what happens is, in the immediate post-operative period or in the early days, when the patient tries to lie on the bedsore, or during change of position, if the patient is unattended and there is weight which is given over the muscle flap, it is very likely that the muscle becomes ischemic and flap necrosis. So that risk is potentially very less in cases of fasciocutaneous flaps. Again, the sensory recovery and potential for re-innervation is there in fasciocutaneous flaps, which is not there in muscle flaps. So overall, I would say, even for ambulatory patients as well as for non-ambulatory patients, fasciocutaneous flaps are preferred over muscle flaps because of their durable skin cover, the lower donor site morbidity, better contour and aesthetic outcomes, superior sensations, and overall versatility. We can harvest them, we can move them in a multiple type of ways. So these advantages make the fasciocutaneous flaps a more suitable and effective option for managing pressure sores.